The purpose of this video will be to do a fairly thorough walkthrough of the SOAP form. This video is intended primarily for doctors, giving a thorough view of their workflow, but it is also good for anyone who wants to see all of the different components of the SOAP form. To begin with, we're going to start in the dashboard. So here, we're going to look for patients that are ready to be seen. So right at the top, I have this patient that's assigned to me. It says that it's ND2 and ready for a doctor, so I know that it's ready for me to go in there. To begin with, we'll also have a travel sheet, a piece of paper that can be put on the table, with status cards as well. I can see the time that it got checked in, so know how long it's been waiting. And I can see the reason for the visit. It's shaking its head. I can also see anyone who has handled this patient already. So we have Dawn who checked it in and Ariana who put it into the room. I can also view any warnings for either the patient or the client here. So for instance, if there were a patient warning, it would also have one of those little red dot with an eye. To enter the SOAP, I just click anywhere in this open space. And we start out on the SOAP summary page, which is this clipboard. So again, here I see that basic information written out. And those can be changed anytime if I need to change the location or even if assign it to a different doctor. As anyone else puts their hands on this, they can add themselves to the assigned user list. The doctor doesn't need to because they're already assigned over here. This is also where we'll be able to create an estimate. So if you're in an exam room and want to create an estimate with the owner, we can start that right here. We'll come back to this feature later. Next, we'll move on to the S for subjective. So here we'll have the brief initial complaint. We'll have any medications or supplements they're currently on. Shepherd will also show you their history of medications, so any medications that are currently active or in the past. And then here, the room tech will write their brief history, and the doctor can add anything to that. And we can save that. So after the subjective is complete, we'll go to objective. So here the room tech has already entered a temperature for this patient. We can see our weight. If we want to take any other values, they'd be added here. This is also where we can indicate the flea check. So if we want to change any of these parameters, let's say we want to make a note about the mucous membranes or capillary refill, we can click edit, and then we'd be able to go in and add to those values. For the physical exam form, so we're going to go over here and click add physical exam. Now there's also an option where we can view past exams. So for instance, if it's like a 10-year-old dog, we know they're going to have several lumps and other chronic issues. We can actually start by clicking on the view previous exams and select one of those, and it'll show us here. And then it'll give us the option to copy that exam. So we don't need to make new notes about chronic conditions. We can just update it for today's exam. In this case, we don't have any previous exams. We're going to start a new one. And this lets us select the type of exam. Now we'll be able to create multiple different types of exams and exam templates. For right now, we'll start with the standard exam with normals. So you'll see here, this probably has a little more information than we're going to want to have on our forms, but we can change those later. And as we go along, if we agree with what's on here as a normal, we can just leave it as normal, and then there's a note. So these are things that we determine, so we can customize these as we'd like to. In this case, we have a dog with some ear issues, so I'm going to say the ears are abnormal, and we'll just say brown debris, some moderate redness, Move along. Everything looks pretty good. Let's just say that there's some moderate dental disease. Move along. We say, yep, these things are normal. Skin. Why don't we also say that there's some mild pododermatitis. Okay, moving along. Everything else looks normal. They're overweight. We'll change their body condition. And then if we have any comments that don't necessarily fit into the physical exam, we can add those here. Then we'll click Save. So it's taking us back to our objective page. And so here we can view the physical exam that we just created. Abnormals are going to be highlighted in red for easy viewing. Any notes would have been put down here at the bottom. Now also on this page, we can see a history of the different parameters such as weight and temperature. As we enter them, it will chart them out here. So going back to the top, we're now going to move on to assessment. So here we can generate a problem list. Know exactly what it is. We don't necessarily have to put a whole bunch, but you can add multiple different problems to the problem list. Let's say already determined this is itis externa. And let's also say we have atopic dermatitis. We can add those. Now we can see over here this patient has already been diagnosed with 2 chronic conditions. And if we want to say atopic dermatitis also going to be a chronic condition, we can add that over there. And we can put some notes here. Let's say symptomatic since 2 years old. And we'll save that. Now, if there are any additional notes we want to make, we can add them here to this assessment box. If we want to give a prognosis, that's an option as well, just for documenting that we discussed that with the owner. Now, we'll also have on this assessment page, laboratory results will show up here, or if we need to scan in any sort of results, those can also be put here. Same with any imaging that we do, random documents, and forms. So let's say we have an anesthesia consent form. That's something that we can have the client fill out here by creating a form, and it will show up and stay with this appointment. So we're going to go back up to the top to move on to the plan. On the plan page, we'll start off with just a basic checkbox if we want to discuss or say what we discussed with the clients as far as diagnostics that we recommended, whether they declined them or not, or if there's going to be any plan based on the treatments that we do here or the diagnostic results. Then we move down to ordering treatments. So in this case, we're going to want to do an ear cytology. We're going to do an ear cleaning. Let's see, we'll also want to do a Vetilog injection. Okay, we'll stop there, and then we'll go ahead and click Add to put those 3 things onto the list. Now at this point, we can decide when we want them to occur, and also if we want to put any extra notes on what we want done specifically for these, we can do that. So to change any of that, we're going to go over to the Edit Treatment. So in this case, we'll let's go ahead and just put a note on here for the cytology that we want both ears, for instance, and we want it done right away. So then we'll go back, we'll do something a little different for the next one. Okay, let's say for the Vetilog injection, we want to put our dose in there. So this was a 99-pound dog, so we'll just say 9.9 milligrams. Now there will be administration routes here once we get all the data into it, so there'll be an option to give that IM. And let's say for the priority, just for demonstration, we'll just say as needed. So this would be if it's maybe not a high priority, the patient's going to be staying for the day. You can say, you know, we're just going to do that later. Okay, and we'll just leave the other one as is here. So now what we can do is we need to tell the system here to administer the treatments or schedule the treatments. So if we're not doing it ourselves right now, we don't want to click the administer treatment button, either up here for all of them or individually. But in this case, we want to schedule them because we're going to take them to the treatment room and have the technicians and the assistants perform the treatment. So we're going to click schedule. Now down here, we had two of them go as stat, so right away, and then we had the Vetilog as needed. If we had scheduled a specific time we wanted something, that would have shown up here. So now when we take the patient to the treatment room, the staff there will see what needs to be done, and we'll go ahead and complete these tasks. Okay, and then we'll say they went ahead and cleaned the ears as well. So once they've been administered, we can go ahead and open up this drop-down menu, and here we can go ahead and put the results of the ear cytology. So over on the side, we have these two buttons, and these go to the shortcuts. So the one with your initials on it is going to be shortcuts that you've made just for yourself to use. The lightning bolt is going to be shortcuts that are used for the whole clinic. So I've created an ear cytology results shortcut. So we can click on ear, and now the technician can go ahead and put the results of the ear cytology right here. And that'll be complete. If they want to add any notes about what was done, they can also just freehand type any sort of notes there for you. So these items are down here because they've been completed. Also, once they've been completed and they end up down here, that means they're on the invoice. So at this point, anything that is put in the computer to be done is marked done, is automatically on the invoice. Now the last item we have here was just to be given as needed. So again, we can also just mark that as administered. And it will show up down here on the history. So now we're going to move to the top again. And we can move on to the discharge instructions. So you can see here that it auto-populated a handout about otitis externa. So any of the diagnoses codes that we attach to a client or a patient, they will automatically generate a handout if we've attached a handout to that code. Now, if we haven't, we can always add any sort of discharge instructions we'd like, or if we don't want them, we can always remove them. So these are completely customizable. These are not preloaded into Shepherd. But this would be just a basic handout. Let's say if we wanted something from VIN or from some other resource, we can copy and paste that into here. If we do so, make sure that there is credit given to the publisher. Now that will automatically print when the patient is checked out. So next we'll move on to prescriptions. So if we were sending home any medications, we can add the prescriptions here. In this case, let's just say we're sending home some Apoquel. So I simply start typing and choose what we need there. We're going to say that this can be a chronic medication so that people know that we can continue refilling it. For now, let's send home 30 of these. We'll go ahead and set up refills. When there are refills available, that means that the client can request refills, and it will indicate to the staff that they can go ahead and complete those refills without having to ask for permission, since the permission was already granted by this. And then an expiration date on those refills. So the default would be 1 year from the date that you write the refill. If it's a controlled medication, you can go to the calendar and you can go back 6 months from that to set a different refill date, or expiration date, I should say. If you need help with a calculator, you can get some extra fields here to help you figure out how many pills. And then we can write the dosage instructions. And again, we can use these shortcuts. So we can generate some shortcuts that might make it a little quicker to write these prescriptions in the future. And then make sure you select the prescribing doctor. And then when we click Save and Print, that will pull up a print dialog box that will send it to the label printer. And now we have the medication we just created. We can always add new ones. We can reprint the prescription label, view and edit the prescription. We can also put any notes on here for future reference. If we have some sort of explanation of maybe we want the client to be able to fill it whenever they request it. If you want to say something about, doesn't matter if it's 6 months down the road, it's okay for them to refill, anything like that. Next, we're going to go up to the top, and this will show us our invoice. So on here, we can see in treatment section the 3 different treatments that we completed today, as well as the prescription. So this is just a line item showing us what we did, and then we can go to the actual invoice. So at this point, this is what the receptionist will be opening to close out the patient. So we won't go into this in this demo here, but again, we can see everything that's on the invoice. If you want to double check the invoice and make sure it's all there, or edit any of those. Also, if you wanted to change the price, you would have the option of going in here and editing the price. So there, we've changed it, and there will be a note that that was manually adjusted. So at this point, we can click the Go Back button, and that'll take us back to the open SOAP form. So at this point, if you've finished with this appointment, then there's nothing else that you have to do in here. You can always just go back to the dashboard and look for any other patients that you're going to need to work on. Now, one thing I wanted to go back to was the estimate. So how we can create an estimate with the owner. So again, I'll go back into this example. And on that SOAP summary page, the first one that comes up, we're going to move down here to add estimate. We'll give it a title. We want to say, like, if it's for mass removal, it's going to be good for like a 3-month period before they need a new estimate. You can add that. So now we can start adding our products. So this is very similar to when we add them to the treatment page. So for a medication that you're prescribing, you're going to want to click this button onto the side. Here you can see this is for prescriptions. That's just going to treat that one a little differently than the others. So we're going to want to add our quantities for the medications. Change the min and the max. Over here it'll show you the price for those items. And with the decline button, what that's going to do is if you offer something to the client and they say, no, I just don't want to do that, then when you press the decline button, it will record that in Shepherd so that you know that it was offered and that the client did decline it, or you can always reverse that. Down at the bottom, we can see the total estimate here. We can make any notes about our discussion about those services and how they were accepted or declined. We'll click Save. Now at this point, if you want to have the client sign the estimate, we can do that here. So you can say Request Client Signature. So that'll pull this up and just create a little text box that you can have them sign right in the exam room with either a mouse or a touchscreen. And then they can click the Approve button. So now that is saved into Shepherd as a signed and dated estimate. So now the choice button has changed to add products to plan or prescriptions. Now in this case, it's going to duplicate these because we already do have them on the invoice. But the nice thing about this estimate is this will automatically transfer them over to our plan. So we don't have to enter these things twice. We just enter them once. Now, one of those items was declined, so that's why we only have 2 here. But again, I don't have to enter them anymore because we already entered them when we created our estimate. So it just kind of skips a step there for us, while also showing the owner how much it's going to cost and giving them the option to approve that. So same thing over here. We can go ahead and schedule the treatments. Take the patient to the treatment room. As they're completed, they can be marked as done. And any notes can be added. Going back to the top, we'll go over to the prescription. And so now it did add another prescription, I believe here. Yes, the pending prescriptions. So it did add this from our estimate. So when we go into the edit mode, we can go ahead and finish out the prescription order. I'm just going to hit cancel since we already have that on there. So again, that was generated from the estimate. Okay. So that's one tool that we can use here to communicate a little bit better with the clients, but it's not duplicating anything. It can just be a slightly different pathway to get to putting these onto the treatment plan. So at this point, our patient will be finished. As they finish the invoice, there will be a little marker on here to say that they are ready for checkout and ready to go home. Once the patient has checked out, this will disappear from this active patient tab. Now, if we've made all of our notes and we're ready for them to leave, that's all we need to do. However, if we're not finished with our notes before it has a chance to check out, when we go into the SOAP form, we can change the status here to in review. When it's in review, that just means that the doctor hasn't finished the notes yet, and it puts it into a special section where you can go back and find it and finish the notes. If you have finished the notes, you can change it to locked. When it's locked, it's not necessarily that we can't go back and edit in anything, but it just indicates that the notes are finished and that nothing should be added. Now, there is also the option of lab pending. So if you send something out to a lab and you finished your notes, but you just want to make sure that it is obvious that you're just waiting for the test results, you change it to lab pending, and that will also put it aside to be reviewed later. So in this case, let's change this to in review. So now when we go back to the dashboard, we'll see that it disappeared from the active patient list. And it's now over here in the in review list under Piper. So we can go back in there and edit and wrap up that appointment. Now here's the other tab for the lab pending. So any case where we mark labs pending, we'll go over here. And then while we're on this page, we can also see any prescription refill requests. They'll populate on this page. You can go in and view the record and approve or deny any prescription refills. Let's go back to Piper. And we'll change the status now to locked to say that we finished with this. So at this point, everyone knows that that exam has been completed. Now, if we want to change it back to an active status, we can simply go back and change that and make any adjustments needed, but make sure you go back and put it back into the locked status when finished. Now that is something that will be tracked over on the history. So you can see here where we change the status to and from. So that will be part of the medical record. And that completes the SOAP overview.